Welcome to our deep dive into informatics and nursing. It's really incredible how technology is changing healthcare, especially for nurses.
Oh, absolutely. It's amazing how informatics is intertwined with so many challenges nurses face every single day.
Yeah, for sure. Like, just imagine this scenario. A 72-year-old patient, let's call him Frank. He's struggling with COPD. After his wife passes away, he keeps ending up back in the hospital. And it's clear that better care coordination, maybe even telehealth, could make a world of difference.
Definitely. And then you have situations like Jorge, who's a nurse manager, and he's dealing with a really high rate of infections from urinary catheters on his unit. Data analytics could be a game changer there. Help him pinpoint the patients at risk and really fine-tune those preventative measures.
And we can't forget about,
Oh, and another one,
go ahead.
Danielle, a passionate new nurse manager who's really gung-ho about palliative care. But she's hitting roadblocks when it comes to those timely referrals in the neuro ICU.
Right, it's all about advocacy.
Exactly. Informatics can give nurses like Danielle the tools to really advocate for evidence-based practices and push for system-wide changes.
It's amazing how informatics touches so many areas of nursing. But before we get into those specifics, maybe we should take a step back. What exactly is nursing informatics?
At its heart, nursing informatics is all about bringing together nursing science with information technology to improve healthcare delivery. And you might be surprised to learn that Florence Nightingale was kind of a pioneer in this field way back in the 1850s.
Wow, really?
Yeah, her meticulous data collection and analysis during the Crimean War, that really laid the groundwork for so much of what we're doing today.
I never knew about that connection to Florence Nightingale.
Yeah.
That's fascinating. So let's fast forward to today. Obviously, there's been a huge push for electronic health records, especially since that HITECH Act back in 2009. It feels like that really kicked things into high gear, right?
Oh, absolutely. The HITECH Act was all about promoting the use of electronic health records that met meaningful use criteria.
Meaningful use.
Yeah, basically, healthcare providers had to show that these systems were actually being used to improve patient care, make things more efficient, get patients more involved in their own health.
Okay, so meaningful use. Got it. But these electronic systems can be pretty complex. What are some of the core informatics concepts that nurses need to really grasp to make the most of these tools?
One of the big ones is the System Development Lifecycle, or SDLC. It's basically a roadmap for building and implementing any kind of technology system. Starts with analyzing and planning, then you move on to designing and developing the system. And then there's testing, training for the users, actually implementing it, ongoing maintenance, and finally evaluating how well it's working.
So it's like a continuous cycle of making things better. But honestly, how much say do nurses actually have in shaping these systems?
That's where it gets interesting. Nurses should be involved in every single phase of that SDLC. Their input is absolutely crucial because they're the ones using these systems every day. They know what works, what doesn't, and what would truly make a difference for them and their patients.
I see how that could make a huge difference in actually having a system that's usable. Speaking of which, I think we've all experienced the frustration of trying to use clunky software.
Yeah.
What are some of the things that make an electronic system truly usable, especially for busy nurses who just don't have time to waste?
Usability is all about making those systems intuitive, easy to navigate, efficient. A well-designed system should reduce errors and minimize the mental effort required. It should make your work easier, not harder. Have you ever been frustrated by a system that felt like impossible to figure out?
Oh, totally. Like trying to find information buried under a million clicks.
Ugh, I know, right? And that's why good usability is so important. It's about simplicity, a natural flow to the design, consistency, so you're not constantly relearning how to do things. And a system that's forgiving if you make a little mistake can really take the pressure off.
Forgiving design. I like that. And what about clear language?
Oh, essential. We don't need a bunch of technical jargon cluttering up the screens.
Agreed.
Yeah.
Okay, so we've talked about usable systems. But what about this idea of system optimization?
Right. Optimization goes beyond just keeping the system running. It's about constantly refining and improving it to squeeze out every bit of efficiency and effectiveness. It's being proactive about making changes based on how the system's actually being used.
So can you give me a concrete example of how a system could be optimized in a way that makes things better for nurses?
Imagine streamlining documentation so it's not such a burden. Or think about updating care plan templates to reflect the latest guidelines. Or even smart alerts that flag at-risk patients so you can intervene early.
So the goal is not just to have a system that's good enough. It's about always pushing for better.
Exactly. And that's where nurses' input is so valuable. They see those little quirks and inefficiencies that could be improved. They know what would make their lives easier and ultimately lead to better patient care.
I'm starting to see how informatics can be really empowering for nurses. But it's not just about typing things into a computer, right? There's this whole concept of standardized terminologies that seems pretty important. Can you unpack that a little?
You've hit on something really key. The language we use in documentation, it really matters. Standardized terminologies make sure everyone is speaking the same language, so to speak.
I can see how that would be important. What would happen if every nurse just documented things in their own way?
It would be chaos. Trying to analyze data from 100 different languages, standardized terms let us aggregate that data, analyze it, generate meaningful reports. We can actually start to measure nursing's impact on patient outcomes in a consistent way.
So going back to Jorge, our nurse manager who's dealing with those high CA-UTI rates,
Yeah,
using standardized data would actually help him to see trends and target interventions more effectively.
absolutely. He could pinpoint specific risk factors, track how long catheters are being left in, and see how well preventative measures are working. Standardized data gives you a powerful lens to understand what's working and what needs to change.
This is fascinating. But what about sharing data between different healthcare systems? That seems like a huge challenge.
You're talking about interoperability, and it's absolutely essential for seamless, coordinated care. Imagine if you're taking care of Frank, and with a few clicks, you can see his entire medication history from his cardiologist, his recent lab results from the ER, even the discharge instructions from his last hospitalization. That's the power of interoperability.
That'd be amazing.
Yeah.
No more chasing down records or piecing together a fragmented picture. How are we doing when it comes to achieving that kind of seamless data sharing?
The Office of the National Coordinator for Health Information Technology, or ONC, they've been pushing hard for nationwide interoperability. They've got a roadmap for getting there. It's all about breaking down those data silos between different systems.
It sounds like we're moving toward a future where information flows freely between different healthcare providers. But with all this data being shared, what about security and privacy? That seems like a big concern.
It's a valid concern for sure. Shifting to electronic systems definitely comes with heightened risks. But there are also strong measures in place to mitigate those risks, both on a system level and things we can do individually.
Like HIPAA, right?
Yeah, HIPAA is a cornerstone of protecting patient data. And on our end, we can make sure we're using strong passwords, being aware of phishing scams, understanding our organization's security protocols, things like that.
Speaking of strong passwords, that's something we hear all the time, but it's easy to get lazy with them. What are some good tips for creating passwords that are actually secure?
Well, first off, never share your password with anyone. And try not to use the same password for multiple accounts. Think about making a passphrase. They're easier to remember and way harder to crack. You could use a favorite quote or a line from a song. And also consider using a password manager. They can be super helpful.
Those are some good tips. So beyond the basics, what does the future of nursing informatics look like? What are you most excited about?
Oh, there's so much to be excited about. One area that's really taking off is patient portals. They really empower patients to actively participate in their own care.
I've heard about those, but could you tell me more about what they can do?
Oh, they can do so much. Patients can access their medical records, schedule appointments, communicate with their providers, even get educational materials relevant to their health conditions. Have you ever used one yourself?
You know, I haven't, but it sounds incredibly convenient.
They're fantastic for staying on top of your health and really helpful for managing chronic conditions, even accessing telehealth services.
Speaking of telehealth, that's another area that seems to be exploding right now.
It is, and it's only going to play a bigger role in healthcare moving forward.
It seems like telehealth has huge potential to increase access to care for people in rural areas or those who have trouble getting around. Like Frank, our COPD patient we talked about earlier.
Exactly. Telehealth could let Frank have virtual appointments with his doctor without leaving home. He could even have his vital signs monitored remotely, so his care team could step in quickly if something's wrong.
Like a virtual safety net. And then there's this whole hospital-at-home concept that's emerging.
It's a fascinating idea. Imagine receiving hospital-level care in the comfort of your own home. We're talking telehealth, remote monitoring, mobile care teams, all working together to deliver that high-quality care in a familiar, less disruptive setting.
What are some of the advantages of that hospital-at-home approach?
Well, for patients, it can reduce the risk of infections they might pick up in a hospital, minimize delirium and confusion, and just improve their overall comfort and well-being. For hospitals, it could free up beds for more acute cases and potentially even lower costs.
Sounds like it could be a win-win.
Yeah.
But I'm sure there are challenges to making that model work, too.
Of course, there are logistical hurdles, technological challenges to overcome, but the potential benefits are so big that I think we'll be seeing hospital at home a lot more in the years to come.
What about those unique nurse identifiers I've been hearing about? How do those fit into the informatics picture?
Those are UNIs, and they're all about showing the value of nursing care by tracking nurse-sensitive outcomes more effectively.
So each nurse would have a unique code that could be used to track their contributions to patient care.
Exactly. Imagine being able to analyze data and see that when nurses are more involved in discharge planning, readmission rates go down. UNIs could be powerful for demonstrating nursing's impact.
It sounds like informatics is giving nurses a stronger voice and really highlighting their expertise. Before we move on, though, there's one more area I'd like to touch on: genomics. That seems like a big part of the future of healthcare.
Oh, genomics is fascinating. It's the frontier of personalized medicine, and it has the potential to totally revolutionize healthcare.
I'm really curious about this. Tell me more.
Genomics is the study of a person's complete set of genes and how those genes interact with each other and with the environment. It can help us understand someone's risk for diseases, predict how well they'll respond to different treatments, even personalize medications based on their genetic makeup.
Wow, sounds like something out of science fiction.
It's becoming more and more real. We already have pharmacogenomics, which looks at how genes influence how someone responds to medications. It's being used to personalize medication choices for some conditions already.
So one day, we might be prescribing medications based on a patient's unique genetic profile.
Exactly. And informatics is key to all of this. We need robust systems to manage and interpret this incredibly complex genetic data, and we need to integrate it seamlessly into electronic health records.
This is mind-blowing. It sounds like we're on the verge of a truly personalized approach to healthcare.
It's an incredible time to be in nursing. The pace of innovation in informatics is amazing, and it's an area where nurses can really lead the way.
I totally agree. With all this incredible technology, though, it's important to remember that it's just a tool. At the end of the day, it's all about using it to improve patient care and make a difference in people's lives.
You're so right. It's easy to get caught up in the technology itself, but our focus has to be on the human beings we're caring for.
Couldn't have said it better. We've covered some of the basic concepts of nursing informatics, and it's clear that this field is changing fast. But let's dive a little deeper into how these concepts actually play out in real-world scenarios. So let's go back to those scenarios we were talking about before. Frank, our 72-year-old patient with COPD who keeps ending up back at the hospital.
Yeah, Frank living on his own and struggling to manage things after his wife passed away.
Right. Can you kind of walk me through how informatics could help to improve his care and prevent those readmissions, which can be so costly?
Well, think about the telehealth options we were discussing. Virtual checkups and remote monitoring. That would allow him to connect with his healthcare team without having to leave home.
Yeah, and wouldn't those smart alerts that we talked about, they'd notify his care team if his vital signs were off or if it seemed like he wasn't taking his meds?
Exactly. Like having an extra set of eyes on him. Those alerts can be crucial for intervening early, could prevent a crisis, keep him out of the hospital. And with a really solid system for interoperability, all of his providers would have that complete picture of his history.
So no matter where he goes, his primary doctor, a specialist, the ER, everyone would be on the same page.
Precisely. That shared information can really help to cut down on those communication gaps that can lead to readmissions. And don't forget about patient portals. Frank could use a portal to access resources about managing his COPD, track his symptoms, even communicate directly with his care team.
So it's all about empowering him to be a partner in his own care. What a great example of how informatics can really support patients like Franca. Okay, what about Jorge now, our nurse manager, who's dealing with those high CUTI rates? How could informatics helping tackle that problem?
Remember those standardized terminologies we were talking about? Those would be really key for Jorge. He could use them to analyze data and identify trends related to COTI cases on his unit.
So he could see if there are certain things that put patients at higher risk, like if catheters are being left in for too long, or if there's variation in practice among the nurses.
Exactly. And then he could use that information to develop specific interventions, educational programs, things like that, to address the issues he's seeing.
I was just thinking those real-time analytics dashboards could be helpful too, right? To see at a glance which patients have had a catheter in for a certain amount of time.
It's all about translating data into action. Those dashboards give you that immediate snapshot of what's happening, which allows nurse managers like Jorge to prioritize care and make sure those evidence-based bundles for COTI prevention are being followed consistently.
Amazing how informatics can bridge that gap between the data and actually putting it to use. Now, let's talk about Danielle, our new nurse manager who's running into those roadblocks with palliative care referrals.
Danielle's a great example of how informatics can help nurses be real change agents. She wants to implement a standard screening tool to identify patients who would benefit from early palliative care consults, right?
Right, she's looking for a system-wide change.
Exactly. Now imagine if that screening tool was built right into the electronic health record. It could prompt nurses to do the screening as part of their regular assessments.
It would make the whole process more efficient, less likely to slip through the cracks during a busy shift. I'm also thinking about those clinical decision support tools we talked about earlier. Could those play a role here?
For sure. The system could be set up to flag patients who meet certain criteria for a palliative care consult, like having a little nudge in the right direction to make sure patients aren't missing out on important care.
This is sparking so many ideas. It's amazing to see how informatics can support nurses in advocating for their patients and improving practices. But let's shift gears for a second. We've talked a lot about patients. What about how informatics can support nurses themselves in their professional development, their career growth?
That's such a good point. Informatics opens up so many doors for nurses, and having those skills is becoming more and more important in healthcare.
So even if a nurse isn't planning to specialize in informatics, just having that basic understanding can benefit their career.
Absolutely. Nurses with informatics skills are in high demand. They're the ones who can help to implement new systems, train their colleagues, optimize workflows, troubleshoot problems, all of that.
So learning about informatics can really make you a more valuable asset to any team.
Exactly. Informatics can also give nurses the tools to move into leadership roles. By understanding the data and using technology effectively, nurses can identify areas for improvement, advocate for change, really drive innovation.
So it's about having a voice and being able to use the language of data to make an impact.
You got it. And for those nurses who are passionate about informatics, there's a whole career path there.
You mentioned before that there are different types of roles for informatics nurses. Can you elaborate on that a little? What are those different paths?
Sure. We have informatics nurse specialists. They pursue advanced education, and they often focus on the big picture aspects of things like system design, implementation, evaluation.
So they're like the architects and engineers of healthcare technology.
That's a great way to put it. And then we have informatics nurses who work at the bedside, supporting the use of technology in specific areas.
So they're the ground level experts, making sure those systems are working for both nurses and patients.
Exactly. And there are opportunities in education, research, consulting. It's a wide open field.
So many ways for nurses to contribute to informatics.
And it's important to remember that everyone has a role to play. No matter where you are in your nursing journey, bedside nurse, manager, student, your insights and experiences matter.
So even if I'm not going to be an informatics specialist, I can still get involved and help shape how this field develops.
Definitely. It's all about being curious, asking questions, staying up to date, and being open to new ways to use technology to improve care.
I love that. That spirit of innovation is at the core of nursing.
It's what makes nursing so great. We're always adapting, learning, finding new ways to make a difference.
Speaking of making a difference, I think we also need to acknowledge the ethical side of informatics. With all this technology becoming so integrated into healthcare, we have to think carefully about the implications.
You're absolutely right. Data privacy, security, access, those are critical considerations. We have to make sure we're using these powerful tools responsibly and ethically.
It's not just about the tech itself. It's about how we use it and making sure it aligns with our values as nurses.
Couldn't agree more. We need to keep having these conversations, bring in different perspectives, and work together to make sure technology is being used to truly benefit patients and improve healthcare for everyone.
It's been amazing talking about all of this. I feel like I have a much better grasp on how informatics is shaping the future of nursing.
It really is such an exciting time to be in nursing. So much is happening. Technology is changing how we deliver care in incredible ways.
Yeah, for sure. And speaking of the future, we touched on genomics earlier. Could you tell me a little more about how informatics and genomics are kind of coming together?
Well, think about it this way. Genomics is giving us a whole new level of understanding about each individual patient.
Right, like we're looking at their blueprint, their unique genetic makeup.
Exactly. And informatics is what lets us manage, analyze, and make sense of all that incredibly complex data. Imagine systems that can seamlessly integrate a patient's genetic info right into their electronic health record.
That'd be amazing. How would that kind of integration change the care we provide?
Well, imagine you're taking care of a patient, and you can see in their record that they have a genetic predisposition for certain conditions. That could help you tailor preventative strategies and screenings.
It'd be like personalized medicine in action.
Exactly. And pharmacogenomics, which looks at how genes influence drug response, is already being used to personalize medication choices. We can use genetic information to predict how a patient might respond to a certain medication, could help avoid adverse reactions and improve outcomes.
Wow. So we're moving towards a future where treatments are really tailored to each person's genetic makeup.
It's an incredible time of discovery, and nurses are right there on the front lines of this whole revolution.
So for all the nurses listening out there, students, seasoned professionals, everyone, what's the one thing you want them to take away from this deep dive?
Embrace informatics. Don't let the technology intimidate you. It's all about using these powerful tools to make patient care better, enhance your own practice, and shape the future of nursing.
I love that.
Yeah.
And it's important to remember that informatics isn't just for the specialists. Every nurse can play a role in how this field evolves.
Absolutely.
Whether you're learning about new tech, sharing your ideas, or advocating for improvements in your workplace, you can help drive positive change.
You said it perfectly. Be curious, ask questions, and never stop exploring how informatics can help you provide the best possible care for your patients.
This has been such a great conversation. Thank you so much for joining me.
It's been my pleasure.
And to all our listeners, keep those questions coming, stay curious, and embrace the power of informatics to change healthcare. Until next time, keep learning and keep innovating.